women in the U.S. are at a much higher risk of losing their babies, according to a new study. The report, Fighting at Birth, Eradicating the Black-White Infant Mortality Gap, finds the infant mortality rate for Black women is the highest of any ethnic group. Even factors like education, age, and socioeconomic status fail to impact the racial disparity. Keisha Bentley-Edwards is a co-author of that report. She's also an assistant professor of general internal medicine at Duke University, and she joins me now from Durham, North Carolina. Keisha, thank you so much for being with us. Can you explain why that infant mortality rates are highest for Black women? I mean, we do know that, unfortunately, about 24% of Black women in the U.S. live at the poverty line or below. But this isn't just about poverty, correct?
Correct. That poverty was what people pointed to, especially in the last, I'd say, 30 or 40 years, actually even longer than that, as a contributing factor for Black women having higher infant mortality rates. However, as we've had war on poverty initiatives as well as healthcare initiatives, these disparities, although the numbers, the infant mortality rates has decreased, the disparity has stayed the same, and for some groups is actually widened. And so that's what's causing so much concern. And
what's especially sort of disturbing or interesting about this study is that it finds that mothers with doctorates, you know, the highest level of education possible, are more than twice as likely to lose their babies than white women. Why does the rate rise for Black women with higher education levels?
Yeah, it's amazing. I was actually surprised that it was that high. I knew that the disparity widened as education levels increase for Black women. And really that is a big part of the question. And once you take away age as a factor, you take away marital status as a factor, this gap still remains. And the one thing that you have to look at is racism, both interpersonal and structural racism, as a contributing factor for these disparities, particularly for people who have higher degrees. And it takes a toll on you. There's been research on the weathering effect on Black women, and you also have to say, what is the price on Black women's bodies for being the first in these rooms, when you're the first person in the room, or if you're the only Black woman in the room? What stressors are added when you have to deal with those issues? Because we should note that among white women, the higher the education level, the lower the infant mortality rate. So it would clearly seem to indicate, as you say, that there is a stressor associated with it. Now, this report also contains policy recommendations. What are some of those? Well, one of the big issues that we wanted to look at was policies, research, and interventions that focus specifically on Black women. So not just, a lot of times these initiatives that are looking to help Black women focus on poverty. However, as our research shows, given educational status, those initiatives that focus on poverty will not reach Black women who are actually vulnerable to adverse birth outcomes. And so we are really pushing for more policies that focus on Black women, as well as having better care for Black women, no matter what their educational status, as far as their maternal care. And the last one is we need to work on discrimination that occurs before, during, and after pregnancy. And so really reinforcing organizations that fight racism in the workplace, in the social settings, and just overall. And we're really calling on allies to back up Black women when you see things aren't going well or that people are being mistreated. But looking back to sort of policy proposals, how have doctors and lawmakers reacted to previous policy proposals suggesting that doctors focus on helping all Black mothers regardless of income status? You know, I think that that's something that hasn't really been touched on. Most times when you talk about Black women, there's an assumption that all Black women are poor. And although we're very much overrepresented in the poverty levels, there are Black women who are doing well financially, who have some degree of wealth, and who have higher education. So in 2013, 2014, I believe about 8,000 Black women received PhDs or professional doctorates. So so it became MDs or JDs. So it's not that we're talking about one or two women that you're talking about dealing with. These are a lot of women who really need help. And so in the past, it was just assumed because in the general population, education is associated with positive birth outcomes, but for Black women it's different. So I think that what this study is really pushing is that you can't look at the general population's protective factors and risk factors and apply those to Black women, and you really have to look deeper. So I'm hoping that this will kick off more initiatives, because in the past they focused on poverty.
Well, Keisha Bentley-Edwards, thank you so much for your insight and your time.
I really appreciate you sharing this information. Thank you.